Greetings, everyone. We're here to talk about 39 North. 39 North is a newer health plan that launched earlier this year in coordination with Banner Health, as well as other incredible institutions that are in Colorado. The cool thing about 39 North is it's built for you. It's actually built for employers in Colorado from people from Colorado and designed to fix what's wrong in healthcare and help you restore the value that you're looking for in your employee benefits today. This is a couple slide presentation that'll last about 10 minutes. So who's an ideal client for 39 North? An employer who's over 50 employees, who is currently level funded or self-funded, who is really tired and looking for a new solution and is ready to take more control over healthcare and is looking downrange and saying, I need to comply with these new regulations with CAA. I want to have better control over my supply chain. And I really want to create an employee benefit package that helps me differentiate my benefits. We think we can do that through 39 North. It's traditionally available for only larger employers, and now it's available for you as a smaller employer, mid-market employer in Colorado. And lastly, the ideal persona is an employer who really cares deeply about their employees and wants to have an incredible experience and offer free healthcare. We'll talk more about that in a few minutes. So Jake, would you mind telling a little bit more about 39 North?
I'd love to, Ken. So 39 North is what we call an unbundled self-funded plan. And you might have heard of this because this is really the most innovative form of a health plan available today. However, it's traditionally only been available to the Fortune 500 companies, the large companies, because it takes them years, months and years to design the right plan, find the right partnerships and the right channels of service and healthcare in order to design this appropriately. We've pulled all of that down, done all the legwork, and combined all of the best and curated those solutions in one bundle, delivered to now the mid-market of Colorado. So this includes direct contracts with hospitals and doctors, transparent pharmacy benefit management, transparent third-party administrators and claims payment solutions, independent care management, all of these solutions that we've identified as the best in cost containment and quality now in one plan, which is 39 North.
So it's kind of like you can have the plans that only the big companies generally get access to.
Exactly.
And it's available today.
It's available today.
Yeah. Super compelling.
So when we think about cost containment, these are really the four key areas that we're looking at in order to drive both that experience and reduce prices for our clients. Advanced primary care really is at the core of everything we do. We are extremely passionate about our experience and driving that great experience in healthcare. And this allows us to have a front door through our partners at Nice Healthcare, where patients, your employees, can quickly access this and not only get unlimited primary care available virtually at their home and in person, but also have a guide through the healthcare system. So this is the base, followed by what's the next level up from primary care? Okay, that's specialty care, that's surgery care and imaging and hospital care, creating direct partnerships and contracts to what we call our centers of excellence, organizations that we've identified as being the highest quality care in Colorado, highest safety scores, and making those direct relationships with them for better unit price and lower costs overall. Next, fully transparent pharmacy benefit manager through our partners at Emsana RX to deliver better medication benefits, wrapping all of this together with data-driven clinical care, where we are actually identifying and understanding the gaps in care on the individual client level and identifying new point solutions that we can deliver.
It's amazing. So for those of you who are familiar with primary care, and those of you who have considered maybe a DPC model, it's generally very expensive. And it's generally, like you said, only available for the larger, like super jumbo accounts. But that's what employers are looking for, is how do I bring care to my members? How do I actually change the way people interact with healthcare? And NICE is the front door to 39 North. NICE is a product that's been out there for 4 years. It's come to Colorado 2 years ago, and it's taking off like wildfire. And so the benefit for the employees is it's all free. Everything on this slide is available at no cost to the members. So if I'm, I have a acute visit, if I have poison ivy or poison oak, I could actually have a clinician come to my home. And when I need medication, by the way, that's free. 550 medications are part of the formulary that are free. All the services on here is available either virtually, in person, or at your clinic or employer. So an incredible differentiator for you as an employer to really change the way people interact with your healthcare plan. Oh my gosh, people are waiting days, weeks, months in order to get in to see care in certain parts of the health supply chain. All this is available. 90% of the care is delivered same day. An incredible opportunity. So Jake, we talked about 39 North. We talked about the benefits, but for an employer who's level funded, self-funded, at the end of the day, they care about what is the bottom line. How can you help me control cost?
Yeah.
Maybe would you mind talking a bit to some of the slide here?
Yeah, absolutely, Ken. So we hear it all the time, right? The only way to actually pay less for healthcare is by paying less for healthcare. And the unit economics of healthcare is what really makes it expensive. And the lack of price transparency is a big key with that. So what we've done is gone out and identified, as I've mentioned, the top quality providers and facilities across the state and said, we're negotiating contracts with you and you only. And what that allows us to do is say, you are exclusive partner, give us your best foot forward on your best rates, and we won't even talk to your competitor over here. We know that they're not as good as you, and you can have an opportunity to really deliver back to the community that you're serving. And a couple of great partners through Banner Health and Centura Health have said, yes, we completely agree. So you'll look at this graph right here, and it represents the difference in cost structures between us, 39 North, and some of the other commercial payers that you might be more familiar with. And the cost change is really 40 to 50% lower at 39 North, at our centers of excellence and facilities, compared to a normal commercial payer product that's been available in Colorado.
So using a gas analogy, instead of paying $4 at the pump, it's the same ingredients, it's $2 less.
It's the same ingredients, $2 less at the pump, exactly.
I think this speaks to how employers are really looking to gain control over healthcare, cut out the middlemen, contract directly with the hospitals, with the health systems, and you've been able to do that very efficiently for employers that are 50 or more employees. I want to spend just a moment about the plan design, and then we've got one more slide, and then we'll talk about next steps and how you can learn more and continue the conversation. But most employers are familiar with Tier 2. They have deductible copay, coinsurance, maybe an HSA. Tier 2 is very similar to what you probably implement today. Very vanilla. It's fine, but it doesn't differentiate. It doesn't pop. It doesn't stand out to a new employee saying, wow, I'm going to come here because it's free. But if you look to the left in Tier 1, all those services, maternity coverage, surgeries, things that are several thousand, tens of thousands of dollars, if you're in a Tier 1 facility, is no cost to the member. And 39 North has designed it so that there's actually no EOB. I mean, what a pleasure to interact with healthcare where it's free and there's no out of pocket. It comes to your home or the clinic. It's just an incredible value. So this plan design, folks, is really a great way for you to think about how could you differentiate your benefit package, gain control over your health plan, and do something that is really powerful, designed for Northern Colorado and the Front Range. So if you're interested in learning more about next steps, please talk to your benefit advisor to learn more. We'd be happy to schedule either an in-person or a demo. To get a quote, we can share with you how much we may be able to save, and then really partner with 39 North to join this new incredible way of doing healthcare and being part of the future of the way things should be. Affordable, easy to use, and designed for you. Thank you so much for listening. Have a wonderful day.